Have you ever stood in front of your medicine cabinet and felt a little unsure, thinking, am I taking this right? You're not alone. Those little bottles can be mighty helpers, but they can also be confusing, even for people who've been taking them for years. After 60, it's common to have a few prescriptions, a vitamin or two, maybe something for sleep, and a bottle for aches and pains. Add in a seasonal cold, and suddenly you're juggling more labels than anyone should have to. That's where mix-ups sneak in. They're simple, innocent mistakes, using two of the same ingredient without realizing it, taking something at the wrong time, mixing an over-the-counter pill with prescription that doesn't play nicely. The good news is most of these can be fixed with a little know-how and a friendly conversation at your pharmacy. Today we're talking about 5 medication mix-ups to avoid and how to get a free pharmacy review that can make your whole routine clearer, safer, and easier. Think of it like a tune-up for your medicine cabinet. No lectures, no judgment, just practical steps that can help you feel more confident every time you open a bottle. Let's start with one of the most common traps, taking two of the same thing without realizing it. You might think, I'd never do that, but it happens all the time because of confusing names and clever packaging. Take acetaminophen, sold as Tylenol. It also hides inside many PM cold and flu and all-in-one products. So you take a pain reliever for your back, and later you reach for a nighttime cold formula. You didn't mean to double up, but you just took 2 doses of the same ingredient. Too much acetaminophen can be hard on your liver, and you won't feel the warning right away, which is why this is such a sneaky problem. Here's how to outsmart it. When you pick up a bottle, don't just read the big bold brand name. Look for the tiny line that says active ingredient. If it says acetaminophen, write a little note on the cap of the marker, contains acetaminophen. Do the same with ibuprofen or naproxen, if that's what you use. And if you're grabbing a cold medicine, pause and ask yourself, is this an all-in-one? If so, it may already have a pain reliever inside. If you're not sure, hand it to your pharmacist and say, can you check if this doubles up with my regular meds? They do this all day, and they can spot duplicates in seconds. This double-up problem doesn't stop at over-the-counter stuff. Sometimes people end up with 2 versions of the same prescription class, like 2 similar blood pressure meds or 2 drugs for pain, because one doctor changed something in the hospital and another doctor didn't get the memo. Or a new generic arrives and you think it's a new medicine when it's really the same thing with a different name and a different color. One easy fix is to use one primary pharmacy whenever possible, so they can see your whole list. Another smart move is to keep a simple medication list in your wallet or on your phone. Write the name, why you take it, and how often. Bring it to every appointment, including the eye doctor and dentist. And yes, this is where free pharmacy review shines. You can call your pharmacy and say, I'd like a medication review to make sure I'm not taking duplicates. Many pharmacies call it a medication review or medication therapy management. If you're on Medicare Part D, you may qualify for an annual comprehensive review at no cost. But even if you don't, many pharmacies will still sit with you and go through it. We'll talk more about exactly how to set that up, but the first step is simple. Ask. Now, let's talk about a different kind of mix-up. Mixing prescription drugs with over-the-counter medicines or supplements that don't play well together. Picture this. Your knee hurts, so you take ibuprofen. Your friend says, take it with a baby aspirin to protect your heart. Sounds helpful, right? Not always. If you're on a prescription blood thinner or even a daily aspirin under a doctor's advice, adding ibuprofen or naproxen can raise your risk of bleeding. You might not notice right away. Maybe you bruise easier, Maybe your gums bleed a bit more when you brush, but inside, your risk has changed. Or consider those decongestants and products with D on the label, like pseudoephedrine or phenylephrine. If you've got high blood pressure or heart issues, that quick fix congestion pill can push your pressure higher. And then there are the herbal helpers. St. John's wort, for example, can speed up how your body breaks down certain medications, making them less effective. That could be a problem if you rely on those medicines every day. Here's the easy rule of thumb that keeps you safe. Before you add anything new, pain pills, cold remedies, supplements, ask a pharmacist. It takes 2 minutes. If you don't want to stand at the counter, call ahead and say, I'm on a blood thinner and thinking of taking something for my back. What's safe? They'll steer you to a better option or suggest a dose that won't interfere. If you live with high blood pressure, ask for a decongestant-free cold relief. Often, plain saline spray, a humidifier, or a product without the D can do the job without messing with your heart. While we're on the topic, let's make things even simpler by getting all your pills into one conversation. Grab a grocery bag, yes, the old brown bag trick, and put every pill bottle in it. Prescription vitamins, herbal teas you drink for sleep, eye drops, creams, inhalers, patches, even that bottle you only use once in a while. Take the bag to your pharmacy and say, I'd love a quick review. Is there anything here that shouldn't be mixed or that I don't need anymore? You don't need an appointment for a quick look, but if you want a full sit down, ask for a medication review by name. Some pharmacies will schedule 20 to 30 minutes to go through everything and print out a clean list you can take home. This is often free, especially if you got Medicare or you take several prescriptions. And it's not just about finding problems. Sometimes they'll suggest small tweaks that make things easier, like switching to a once-a-day version, lining up your refills, or moving a pill to bedtime so it doesn't upset your stomach. Another important piece is knowing what questions to ask. 3 favorites that never fail. What is this for? How should I take it? And what should I watch out for? If the answer is vague or you forget it later, ask them to write it down on a printout or label. You won't bother anyone. Clear instructions are part of the service. I want you to imagine how much lighter it would feel to know your medicines are working together, not against each other. No guessing. No digging for a magnifying glass to study tiny labels in the middle of the night. Just a simple, calm routine you can trust. That's the goal here. We're not trying to turn you into a pharmacist. We're making your life easier and safer with a few small habits that make a big difference. So far, we've sidestepped 2 of the biggest troublemakers, doubling up without realizing it, and mixing prescriptions with over-the-counter products and supplements that don't belong together. Each fix centers on one theme. Slow down for a moment, read the active ingredient, and ask for a quick check from the folks who read labels all day long. Add in that free medication review, and you'll be 3 steps ahead already. Let's keep the momentum going and clear up another mix-up that surprises a lot of people, even those who have been taking their medicine for years. Here's the one that surprises a lot of people. Timing and food pairings. The same pill can behave very differently depending on when you take it and what you swallow it with. Picture a morning where you grab your pills, take a sip of coffee, and head out the door. It feels efficient, but some medicines need a little more attention to work their best. A classic example is thyroid medicine. If you take levothyroxine with breakfast, or even just with a calcium tablet or a multivitamin, your body may not absorb it well. Then you go back to your doctor, and your lab numbers aren't where they should be. It's not that the medicine failed. It just didn't get a fair chance. A simple switch to taking it first thing in the morning with water, waiting about 30 to 60 minutes before food or coffee, can make a big difference. If mornings are too hectic, bedtime on an empty stomach works for many people too, as long as it's a couple of hours after your last snack. Calcium and iron are great for bones and blood, but they can hog the spotlight if they arrive at the same time as certain medicines. Some antibiotics and thyroid pills just don't like sharing the stage with those minerals. Space them out by a few hours and they can both do their jobs. The same goes for fiber supplements. Wonderful for digestion, but better taken at a different time than sensitive medications, so they don't get trapped and carried away before they're absorbed. Then there's grapefruit. It looks innocent in the fruit bowl, but grapefruit and grapefruit juice can change how your body handles some prescriptions by slowing down the enzymes that process them. That can raise the level of the medicine in your system, sometimes too high. If you enjoy grapefruit, ask your pharmacist whether it's okay with your specific medications. Often there's an easy swap, orange or apple instead, and you won't miss a beat. Timing matters for comfort, too. If you take a water pill late in the afternoon, you might find yourself up half the night running to the bathroom. Move it earlier in the day, and your sleep improves immediately. Some cholesterol medicines work a touch better taken in the evening, while nausea medicines are more helpful if you take them before you start to feel queasy. Pain relievers can be kinder to your stomach when taken with a little food, but others are meant for an empty stomach. If you're not sure which is which, that's a perfect question for a quick call to pharmacy. Tell them when you usually eat, when you sleep, and they'll help you build a schedule that fits your life. A simple way to keep all of this straight is to create a med map that matches your day. Morning with water, breakfast, lunch, dinner, bedtime. Pick your anchors and tuck each medicine where it belongs. If you like visual cues, add tiny colored stickers to your bottles. Blue for morning, green for with food, yellow for bedtime. Or ask your pharmacy about larger print labels, easy open caps, or even blister packs that sort pills by time of day. Many pharmacies can line up refills, so you pick everything up once a month, and some will package your doses together in label packets. It's safe, it's tidy, and it saves you energy. Your free pharmacy review is a great place to fine-tune timing. Bring your actual bottles so the pharmacist can see which versions you have. Say, here's how my day goes. Where should each of these fit? You can even bring a list of your favorite foods and supplements, and they'll point out any that need a little space from your pills. The goal is not perfection. It's a routine you can follow without thinking twice. Now, let's talk about another kind of mix-up that doesn't get enough attention, using the right medicine the wrong way. Technique matters more than most people realize, especially with inhalers, eye drops, patches, and any pill that's designed to release slowly. If you've ever wondered why your inhaler doesn't seem to help like it used to, it could be as simple as the way you're pressing and breathing. Many inhalers work best with a spacer, a small tube that gives the medicine time to slow down, so you can inhale it deeply. Without it, a lot of the dose can hit your tongue or the back of your throat instead of your lungs. If your inhaler contains a steroid, there's one tiny habit that protects you from a sore mouth. Rinse and spit after you use it. You won't taste the difference, but your mouth will thank you. Eye drops are another place where technique makes a huge difference. One drop is enough. More than that just runs down your cheek and wastes the medicine. If your drops sometimes make your heart race or make you feel odd, try this trick. After the drop lands, gently press the inner corner of your eye by the nose for a minute. That slows the drip into your system and keeps the medicine right where you need it. If your hands shake or your vision makes aiming hard, ask your pharmacist to show you an applicator device or a steady hand method. They have practice bottles and love to teach. Patches can be wonderfully convenient, but they have rules. They like clean, dry, hair-free skin. They don't like heat. A heating pad or a hot bath can push too much medicine through too fast, which can be dangerous with certain pain patches. Rotate the spot where you place it so your skin doesn't get irritated, and don't cut a patch unless the label specifically says it's safe to do so. Cutting most patches changes how they release the medicine and can dump too much at once. If your patch keeps peeling off, ask about adhesive overlays designed just for that purpose. Then there are the pills that should not be crushed or split. Extended release tablets and capsules are built to release your dose slowly over time. Crushing them can give you the whole dose at once, which might make you feel lousy or cause side effects your doctor was trying to avoid. If a tablet is scored, that little line down the middle, it's usually okay to split. If not, check first. If swallowing is hard, tell your pharmacist. There are often liquid versions, smaller pills, or safe alternatives. This is where your pharmacy can be an incredible partner. Ask for a show me session. Say, I want to make sure I'm using my inhaler and drops correctly. They'll watch you do it, then gently coach you so you leave feeling confident. If arthritis makes opening bottles painful, ask for easy open caps and a clear explanation of how to store them safely. If small print is a challenge, request large type labels or a printout in a bigger font. If you worry about mixing up morning and evening, ask about customized packaging that sorts everything by time of day. These services are often free or very low cost, and they remove so much daily stress. While you're there, take advantage of one more time saver called synchronization. It simply means a pharmacy lines up your refills so they all come due together. Instead of 3 trips in a month, you make one. They can also set up reminders by phone or text or deliver to your home if your area offers it. When everything arrives on the same day, it's easy to keep track and it makes your monthly brown bag review simple. Dump the old bottles, keep the updated ones, and you're set for the next 4 weeks. Getting timing right and using each medicine the way it was designed might sound like small adjustments, but they're powerful. They help your prescriptions do their best work and reduce side effects, and they take the guesswork out of your day. You deserve a routine that supports you, not a routine you have to wrestle with. There's one more troublemaker we need to tame, and it tends to show up during life's transitions, after a hospital stay, when a new specialist adds something, or when you feel better and decide to stop a medicine on your own. Those moments can stir up confusion, duplicate drugs, and missed doses in a heartbeat. Let's sort that out so changes feel smooth, safe, and under your control. Those transition moments can be tricky, not because you've done anything wrong, but because the information doesn't always travel with you. You leave the hospital with a new pain pill and something to protect your stomach. Then you get home and see the old bottles still sitting on the counter. Do you keep taking them? Do you stop? That's where confusion creeps in. A calm way to handle it is to treat any change like a fresh start. Take the discharge papers or the note from your doctor, set them next to your pill bottles, and compare line by line. If a new prescription replaces an old one, move the old one out of reach, zip it into a plastic bag, and label it stopped. If you're not sure whether a medicine is temporary or long-term, make a quick call to the pharmacy and say exactly that. You can even read the label over the phone. They'll translate the doctor speak and, if needed, call a prescriber to clear up mixed messages so you don't have to play go-between. Stopping on your own can be just as risky as taking too much. Maybe your blood pressure looks great and you feel terrific, so you think, I don't need this anymore. Or a pill makes you a little queasy, so you skip it for a few days to see what happens. Some medicines need a gentle exit. Steroids, antidepressants, and certain heart medicines can cause rebound symptoms if they're stopped suddenly. You might feel dizzy, anxious, or just off. Don't power through that alone. If something isn't sitting right with you, say it. Call the pharmacy and describe what you're feeling. They can often suggest timing tweaks, food pairings, or a plan to talk with your doctor about alternatives or a safe taper. You deserve to feel good on your medicines, not just put up with them. Sometimes the mix-up comes from having many cooks in the kitchen. A specialist adds a new pill, your primary care doctor adjusts another, and your dentist prescribes an antibiotic. Nobody's being careless. It's just a lot to coordinate. Pick one pharmacist to be your quarterback. Keep all your prescriptions there when you can, and give them permission to share your updated medication list with your doctors. Bring your list to every appointment, even if it's for your eyes or your feet. If a new clinician suggests a medicine, ask them to check it against your list before you leave the office. That one extra minute can prevent days of confusion later. Another helpful habit is setting a check-in after any big change. Mark your calendar for a week after you start a new medicine and write pharmacy check. Call and say, I started this last Tuesday. Here's how I feel. Is this normal? Should anything have improved by now? Pharmacists know the timelines. What should feel better quickly? What takes a few weeks? What side effects usually fade? And what should be addressed right away? If cost is a barrier with the new prescription, tell them that too. They can look for a generic, a coupon, a different size or supply, or even a therapeutic alternative to bring the price down without compromising your care. Cost and confusion often go hand in hand. Maybe you stretch a medicine to make it last or skip doses when you're close to refill day. That's a mix-up worth fixing because it can make your treatment less effective and your symptoms bounce around. Be open about it. There's no judgment here. Sometimes a 90-day supply is cheaper and means fewer trips. Sometimes your plan prefers one brand over another. Sometimes it's as simple as synchronizing all your refills, so you're not juggling different dates. These are solvable problems once someone knows they exist. Disposal matters, too, especially after a hospital stay or surgery when you might have a leftover painkiller or an antibiotic you didn't finish. Don't keep old opioids just in case. Most pharmacies and police stations have take-back programs or secure drop boxes. If that's not available, your pharmacist can explain safe at-home disposal methods to keep curious grandkids, pets, and even your own future self from accidentally taking something that's no longer right for you. While you're at it, take a quick look at expiration dates. Many medicines keep their power for a while, but liquids and nitroglycerin tablets, for example, can lose strength sooner. If in doubt, ask for a fresh supply so you're not relying on a bottle that's past its prime. Now, let's make the free pharmacy review feel simple and doable, because this is where everything you've heard comes together and turns into a plan you can trust. Call your pharmacy and say, I'd like a medication review to make sure everything I take is safe together and that I'm using it right. If you have Medicare Part D, mention that, because you may qualify for a comprehensive review at no cost. If you don't, ask if they offer a quick brown bag review or a sit-down consultation. Many do, and they'll gladly schedule a time. Before you go, gather your whole world of medicines. Not just the prescriptions. Add your vitamins, herbal supplements, ointments, eye drops, inhalers, patches, CBD products if you use them, and even the over-the-counter pills you take once in a while, like sleeping tablets or cold remedies. Toss them in a bag along with your latest doctor visit summary or hospital discharge papers. Write down a few things you want from the visit. Maybe fewer trips to the bathroom at night because of a water pill, less heartburn, a plan to remember morning doses, or a way to avoid that afternoon slump. When you arrive, tell the pharmacist how your day looks. Share when you wake up, when you eat, and what worries you most. The more the plan fits your life, the easier it will be to follow. During the review, expect a friendly back and forth. They'll look for duplicate ingredients, interactions with your supplements, timing conflict with food or coffee, and places where technique might be improved, like inhalers or eye drops. They may suggest changing a medication to a once-daily version, moving a dose to evening, switching a capsule to a liquid if swallowing is hard, or arranging easy open bottles and large print labels. They can also set up monthly refill synchronization, delivery if available, and reminders by text or phone if that would ease your mind. Before you leave, ask for a printed medication list that shows what each item is for, how to take it, and what to watch for. Tape that to your fridge or tuck it in your wallet and bring it to every appointment. If you like your doctor's a habit, ask the pharmacist to send it directly so everyone's on the same page. If you have a spouse, partner, or adult child who helps you, invite them to the review or put them on speakerphone. 2 sets of ears are better than 1, and it helps your support team feel confident too. If you're a caregiver yourself, a review can be a lifesaver. It turns worry into a clear plan with specific steps, and it often reveals small fixes that make daily care smoother for both of you. When you step back and look at the big picture, the mix-ups we've talked through share a common theme. They're everyday moments that pile up. 2 bottles with the same ingredient, an over-the-counter pill that doesn't fit with prescription, the right medicine at the wrong time, a device that could work better with a tiny tweak, and those transition periods when changes hit all at once. None of them requires perfect memory or a medical degree to solve. They just need a pause, a question, and a little teamwork with the person behind the pharmacy counter who knows your name. You got more power than you might realize. A marker on a cap that says contains acetaminophen, a note on the fridge with your med map, a habit of asking before you add something new. These are small moves that protect you in big ways. And that free pharmacy review is the anchor that keeps it all steady, so you don't have to carry the puzzle pieces in your head. If any of this sparked an aha for you, share it in the comments. Maybe you discovered a duplicate ingredient once, or you found a timing tweak that changed your sleep. Your story might be exactly what someone else needs to hear today. If you found this helpful, tap like so more people can find it, and subscribe for more simple, practical health videos made with you in mind. We're building a community where your questions and experiences matter. Most of all, remember this: small changes add up. You don't have to fix everything at once. Start with one easy step. Call your pharmacy, ask for that review, and bring the bag. From there, it's just one straightforward conversation after another, guiding you toward a routine that's safer, calmer, and built around the life you want to live. Here's to clarity, confidence, and feeling your best at any age.